Hi, uh, this is my 33rd week of teen pregnancy update, part 2. In the last video, part 1, I was talking about what all the precautions that I was taking in order to avoid a preterm labor or a sudden water break that happens in teen pregnancy. So I talked about 2 points mainly. One, how I used to avoid holding pee. I used to go to toilet every every now and then, and I never sleep continuously for 4 or 5 hours. In between, I'll take a break. When I'll wake up somehow, then go to toilet. I'll make sure that my bladder is light. Second thing, my diet and water intake. uh, so that's in the previous video. Now I would like to talk about the difficulties that I'm facing in this week. The main changes in me, if you look into my face, if you can see the video that I had posted in 4 months before, it has got more darkened, and it's a little bit swollen. My nose is a bit more larger than the previous one. So those are some facial features, sudden facial features that have changed. Those my nearby family members can, or my friends can notice. uh, the difficulties are mainly my swollen feet, which I'm really tracking, because if blood pressure is high along with this swollen feet symptom, that is not a good sign. That can lead to preeclampsia, which is not a good thing. So I'm keeping track of my blood pressure, which is fine, normal. The second one is, I do have a wrist pain uh, in this part of the here in this part. I have real pain. If I'm not using this support, suddenly I'll feel like it's breaking. When I'm doing something, I'll have a sudden pain over there, but with this support I am fine. So I hope it will go away with the delivery. Okay, hoping for that. Then nowadays I'm feeling more heavier than the other weeks. It's like, not always, sometimes I'll feel very light also, but at the same time, if I'm feeling very lightweight in the morning, in the evening I may feel like it's very heavy. I won't be able to wake up from my bed. So that's another change. Then shortness of breath, yeah, that is another thing. If I'm talking, I will always feel like I'm running out of breath. But even if I'm not talking, I'm just taking taking rest on my bed. Then also, at times I will feel like I am running out of my breath. At that time, I'll have to wake up and sit, or just take a walk of 1 or 2 minutes outside. Then I'll feel comfortable, then I'll come back. So this feeling is very constant, shortness of breath. Apart from that, things are fine. uh, this 33rd week is going to end. i'll i'll uh, I'll give you more updates on my completion on 34 weeks soon. See you, bye.